1 in every 2 smokers will die from their addiction unless they stop. We all know that the best thing for our patients' health is for them to stop smoking, but sometimes it's challenging to address concerns about how they will cope without cigarettes when they're dealing with mental health problems and life stress. Tobacco use and mental health are strongly linked. People with mental health problems are more likely to smoke, and other factors such as stress, low mood and anxiety can lead to smoking. Many people think that smoking helps to reduce symptoms such as low mood and anxiety. However, recent research suggests the opposite may be true. Smoking tobacco might actually cause mental health problems, and stopping smoking can improve mental health. In fact, the improvement in mental health when people stop smoking is similar to the effect seen when people take antidepressants. And there's certainly no evidence that stopping smoking will make mental health problems worse. It's important that we share this information with our patients, reassuring them that stopping smoking will not have a negative impact on their mental health. This knowledge could empower and motivate them to stop smoking. Research shows that smokers can double their chances of stopping smoking when they have behavioural support and smoking cessation medication like nicotine replacement therapy, varenicline or e-cigarettes. When someone starts smoking for the first time, there are some rewarding effects of tobacco on mood and cognition. However, as they become used to the effects of tobacco, these go away, and they're smoking only to alleviate withdrawal symptoms like low mood, irritability, poor concentration and anxiety. If your patient smokes on a regular basis, they will feel these withdrawal symptoms much of the time, with short periods of relief only when they smoke and shortly after. This is called the tobacco withdrawal cycle. When caught in this cycle, people can mistakenly believe that smoking helps relieve symptoms of anxiety or low mood. But this isn't the case. These symptoms are caused by tobacco withdrawal. Stopping smoking will eventually alleviate these symptoms altogether. Improvements in these symptoms usually start 6 weeks after stopping smoking, and then the cycle is broken. Tobacco use is a vicious cycle that can negatively affect mental health. It's useful to explain this cycle to patients who smoke and who have mental health problems. From here, you can then help them understand how their smoking and mental health are linked. This information can be formulated as part of their presentation, and a clear understanding can be sought about how smoking can become a maintenance factor in their mental health difficulties. 20 minutes after smoking a cigarette, levels of nicotine and other chemicals start to reduce. This leads to physical and psychological tobacco withdrawal, with symptoms such as poor concentration, insomnia, feelings of tension, restlessness, low mood and anxiety. You can see how most of these symptoms can be attributed to a mental health problem. Using a CBT model is a helpful way of supporting patients to see how their thoughts, emotions, behaviour and physical sensations are interlinked in the context of their tobacco use and mental health. To promote smoking cessation for people with depression or anxiety, behavioural activation or activity planning, as well as motivational interviewing, might be a useful way for your patient to make a quit attempt. In the case of anxiety disorders, depression and low mood, the 5 areas of the model can help us understand that feelings of anxiety and depression can be a trigger for smoking. This may be an effort to calm themselves down, reduce anxiety, make themselves feel, give themselves a break, or to self-medicate. As smoking provides short-term relief from withdrawal, and as the patient thinks they feel better after a cigarette, this reinforces their smoking behaviour. However, as little as 20 minutes later, this cycle will happen again, generating further feelings of anxiety, sadness, or hopelessness. These models show how these areas interact with one another to maintain an unhelpful coping behaviour, or maintain a pattern of low mood.